crisis has shown is that it's making use of the technology is at its heart a data problem. Algorithms need to be trained on large amounts of information before they can be put to work. Still, in many instances, that's the case. And there are many institutional and technical barriers that make it hard to collect and apply information in the population-wide real-time way that is needed. One oft-cited obstacle to deploying and using AI is the lack of access to high quality and accurate data. Better data could allow member states to better understand what works and what does not work to combat the spread of the virus and make more informed decisions. But data quality varies from one country to another. Data sharing is also a pressing issue. Right now in Europe, what we see is that European countries are collecting data in silos. They're using different standards. We don't necessarily have data sharing agreements at EU level to be able to facilitate the sharing of data. So we don't have that infrastructure. It's not clear to all stakeholders how to consolidate dispersed data collection efforts, and this slows down the ability to use that data for the purposes I mentioned, including for AI systems. Because to make sure AI systems work, they do require a certain quantity of data and quality data. That means sufficient data, but also data that's representative and diverse enough. So really, as part of the bigger picture beyond COVID, there is this also important to keep in mind, this technological race to mastering the capabilities that are prerequisite to the developing AI systems. As countries understand, this can give them a competitive advantage in the digital economy. And in my work, I see that EU can really only catch up if it fast forwards the development of these critical systems. So it needs to have the institutional and regulatory framework that enables that, and the infrastructure to help sharing good data at EU level. It's important to be cautious about lessons learned in what is still currently unsolved and what is really an emotionally loaded debate in many ways. It's easy to say that countries with authoritative regimes did better than democracies, or that we could have acted better, prepared our healthcare systems better. We can't realistically have healthcare systems that are fully adapted to pandemics, but we can have systems that are agile and flexible enough to deploy quickly the capabilities needed. And again, the crisis shows that some decisions tend to be short-term oriented, and that tends to backfire. But what is missing, I see, is really coordinated, concerted action between European countries. It's a little disappointing to see that member states move forward either in isolation with their own measures or put EU solidarity to the test and jeopardize the foundation of the bloc by being reluctant to adopt common measures. So it's not so much that the EU is not doing enough. I think they've been taking a lot of important measures. It's more at national levels are we willing to share and to do more together. Another point I can mention is, many health policy decisions about the COVID have been primarily based on virus-centric epidemiological models that extrapolate from data that just isn't always great, just because we really have no idea about the real infection rate or about the amount of immunity that has been built up. And so evidence-based policy analysis and policy making will have a lot to answer for after all of this is behind us. And finally, one has to keep in mind that the EU is not one country, it's 27 member states, and it takes a huge effort to have a level of coordination that can really, help navigate through crises like this one.